Peripheral neuropathy is a debilitating side effect of some of the cancer treatments. It's not just found as a side effect of cancer treatments. It can be caused by a number of things, but in our world, it is definitely a consequence of being exposed to certain chemicals or toxins, such as chemotherapy.
If we break down the word, peripheral neuropathy, peripheral, I'm assuming meaning everything outside of the center. Neuropathy speaking about the neurons in your body, so the nerves.
It's damage to nerves,
Okay.
and it's damage to nerves in the peripheral system. So in other words, it's damage to nerves that do not involve the brain or the spinal column.
You say nerves. Is it one type of nerve? Are there many different types of nerves that are affected by it?
I think peripheral neuropathy can loosely be categorized into 3 different types of nerves that are involved. The first type are the sensory nerves, and these are the nerves that are often located in your skin and would be sensitive to things like touch, to pain, to vibrations.
So very self-explanatory sensory nerves.
Sensory
It's the
nerves.
things that you're sensing.
Of course.
Temperature, touch,
Of
pain.
course. A second type of nerve would be the motor neurons, the nerves that are involved with movement. And thirdly, the autonomic nervous system.
So if I had to guess, autonomic being automatic. So things like potential reflexes, maybe all of the things that are handled automatically, your blood pressures, etc., more of your internal systems.
Automatic, such as your blood pressure, such as your temperature control, such as your ability to perspire or not, sweat.
Yeah.
And sometimes those autonomic nerves also control your bladder function and your digestion.
So you've mentioned 3 different types of nerves that can be affected. What would some of the side effects that we would experience be based on which one of those nerves are affected?
Let's start with the sensory nerves and your ability to interpret impulses causing pain. If we use an example of putting a light blanket over your feet, you and I, possibly that wouldn't be a painful experience. But if your sensory nerves have been affected and damaged, that could be quite a painful thing. Just the very light weight of a blanket on your feet could be interpreted as being exquisitely painful. Or you might not be able to interpret temperature, so you might have real difficulty in things that are hot and cold, touching things that are hot and cold. So many patients in the past have told me who have peripheral neuropathy, they cannot touch anything that is silver. They can't touch metal because they interpret it as being very, very painful. They can't touch hot things or cold things, and sometimes they don't know the difference. So I have a patient who will put oven gloves on before she opens the fridge to take out a bottle of milk because her hands can't touch that cold. A real concern and a danger is not being able to appreciate hot things. So you put your hands close to a candle and you can't interpret that that candle is actually hot, and the risk of burning becomes massive.
So if the nerves are the highways that our brain receives signals from for our body, so in this instance we're talking about sensory nerves. The sensory nerve is the channel of information from the candle at the tip of my finger, which takes this feels hot to my brain. Peripheral neuropathy is the damage to that nerve, so the information that arrives at our brain is different to the information that left the tip of our finger. So this candle is hot, but by the time it goes down that nerve channel towards my brain, that signal has changed from it's hot to it's cold, or this metal surface is painful. Is that the general idea?
There's been a damage to the nerve, so that impulse conduction has been affected. And so the interpretation of the information might be altered. With the sensory nerves, we have an altered understanding or interpretation of that impulse from cold, from vibrations, from pain. The senses are interpreting things differently because there's been damage to those specific nerves.
That could then also be the same for the motor nerves, because if there's damage to the motor nerves, you would be losing a lot of the maybe muscle strength, muscle coordination, your ability to hold a pen and write maybe.
There's a little bit more weakness than normal.
Okay.
You might be feeling a lot more wobbly than usual. So the danger and the risks of falls becomes quite apparent because you need to be aware that there has been damage, and I need to now try and keep myself a little bit more safe than usual because I'm more prone to fall or slip or topple over. And finally, the autonomic nervous system, whereby your blood pressure might not be controlled as what it should be. You might find that you are unable to perspire, or you might be perspiring excessively, again because those nerves have been affected or damaged. Autonomic nervous supply would also potentially affect your bladder control, the way that you urinate. It might affect the way you process food, your digestive ability.
So with the side effects, how long can we expect to experience them? Is this a permanent thing? I mean, damage to nerves usually we'd find is more of a longer term situation. Is that the case here?
It's an excellent question. There can be improvement over time. Certainly if you withdraw the stimulus that was causing the damage in the first place. So for example, we know that certain chemotherapies can cause peripheral neuropathy. And by not giving those chemotherapies, changing to a different type of treatment may improve the side effects that are experienced. But it happens that so often the nerve damage is permanent. And so that is a side effect that we would have to manage over time.
So with the side effects, what are the initial stages of presentation? What is the first thing that I'm going to feel if I'm starting to experience peripheral neuropathy? And when do I then take it to my doctor? At what point do I escalate these concerns?
Like all of the side effects, it's hugely individualized. Often patients will say that they start becoming aware of tingling sensations running through hands and feet. And it tends to escalate as long as that causative agent, and the example that we're using is a specific type of chemotherapy. Not all chemotherapies cause peripheral neuropathy, but those specific types, as long as you are taking that medication and you're exposed to that particular toxin, these side effects tend to start escalating, start increasing over time. So it might be after the first or the second exposure that you start feeling these tingling, stabbing, pins and needles type of feelings. And the more that you're exposed to that particular toxin, the more the experience of this starts increasing.
So any physical experience of some of these side effects which may feel outside of the norm, losing balance, the pins and needles, anything that remains for any sort of elongated duration of time while you're on a specific treatment could be indicative of peripheral neuropathy.
Absolutely. And like any side effect, we want it to be managed. It's an open communication between yourself as the patient and your treating team. You're in this together, and you want to be communicating with your healthcare provider to say, this is a change that I'm experiencing. Is it something I should be alarmed about? Is it something that can be managed? Can we talk about it? Can we discuss it so that we can try and either change treatment if necessary or manage the side effect appropriately, that it doesn't become debilitating, it doesn't hamper on your quality of life.
Because the earlier you engage, the less damage you would have received to your nerves, so the better your long-term outcomes would be, I would assume.
As always, communication is key.
So a potentially difficult question. If you're speaking about the fact that we would need to remove the stimulus in order for the nerves to be able to recover, but we're on a cancer journey on our treatment program, and we can't remove that stimulus because we need to continue treating the cancer, how do we manage it? Or do we just continue on with the expectation that that is going to be a side effect we're going to have to live with?
No, absolutely not. Like any of the side effects, it needs to be reported to your healthcare professional. That's really an important thing to do. Because once that healthcare professional, in this case the doctor, is aware of the side effect, it certainly would be monitored, it would be measured, it would be, you would see, how debilitating is the side effect. And it might be that the doctor will realize that that particular treatment is probably causing the side effect, and therefore we continue to treat the cancer, but we just use different chemicals.
So now that we're on to treatment, what is the treatment for peripheral neuropathy? How do we treat that?
It's a difficult one to treat. It really is a difficult one to treat. There are medications that can be used. Now, interestingly enough, some of these medications might be the anti-seizure medications, the anti-epileptic medications. And you might see that your doctor has prescribed medication and you say, but I don't have epilepsy, why am I taking this? It's for the peripheral neuropathy. Very similarly, other medications that are sometimes prescribed by your doctor would be your antidepressive medications. And again, you might be surprised to see this prescription, but I don't have depression. But it's not for depression, it's been prescribed because of your peripheral neuropathy. But what is important to know is that it's not just medication, it's not just pharmaceutical interventions. There are a lot of other things that are non-pharmacy, non-medications, and they are equally important, such as physical therapy. Because peripheral neuropathy tends to affect hands and feet most prominently.
Being the most peripheral.
Being the most peripheral. And experiences or descriptions being burning, tingling, stabbing. Some patients have said their feet feel as if they're walking on hot coals. Beautiful descriptions of a terrible side effect. Physical therapy becomes so important because we've described the dangers of possibly falling, of not sensing things not as accurately as previously. Physical therapy to assist with your movement, assist with fine motor coordination. Perhaps there are some devices that might be recommended. As difficult as it might be to hear, it might be advisable to use a walking cane or a stroller just to make sure that your balance is contained or a little bit more secured. It's rough when we tend to think of old people using strollers, and in fact you might need that just to assist you to stop you from falling. Along with these non-medical interventions, it is really important to take very, very, very good care of your feet and your hands. Because your sensation has been altered and you're not sensing things as what you normally did. You might, for example, stub your toe. You might walk on something and hurt and injure your foot and not be aware of it. So looking at your feet, paying attention to your feet. Very often, perhaps wearing shoes, not barefoot. A lot of patients with peripheral neuropathy will say they absolutely cannot walk barefoot anymore. But wearing soft shoes, taking care of your hands becomes massively important. And there are lots of home remedies that are out there. Now, these are not scientifically proven.
Oh, that's the term home remedy.
That's the term home remedy, but there's so many of them and they're so interesting. So one of them I heard about quite recently from a very dear gentleman who suffers from peripheral neuropathy. He was saying he gets a sheet of cling wrap, and on top of this sheet of cling wrap, he puts a piece of paper towel. He takes olive oil and sprinkles olive oil on the paper towel.
Fancy.
And then cayenne pepper on top of that. And he wraps his feet in this concoction every single night, puts socks over that, and goes to sleep. And he feels his feet are nice and toasty, he sleeps like a dream, and his peripheral neuropathy improves during the night when he has this on. So I do want to just mention that there are many home remedies out there. Some of them work, some of them don't. So often, the best home remedy is the one that works for you. But like anything, approach with caution, because we know that many of these home remedies are not tested and tried and studied widely, and it would be of great concern if they cause more damage rather than actually assisting. But if you do have any home remedies out there that have worked for you, please won't you consider just jotting them down, putting them in the comment section below, because it might be helpful to so many others that are really struggling with this nasty side effect of some of our cancer treatments.
Thank you for joining us on this video about peripheral neuropathy. Please don't forget to put any of your own experienced home remedies in the comment section below so that you can share your knowledge and your information with other people who are experiencing this very, very difficult and often debilitating side effect of some of the treatments of cancer. As always, join our community. There's a lot of information on our channel that may interest you and may help you through your cancer journey or those of your loved ones as a caregiver. Thank you, and we'll see you in the next video.